You walk into an in-network hospital for emergency surgery. You check every box. You did everything right. Then the bills start arriving. One from the surgeon, in-network. One from the hospital, in-network. And then a third bill. This one is from the anesthesiologist. The amount is $7,000. And there is a note at the bottom. This provider is out of network. Your insurance paid $2,000. You owe $5,000. You feel sick. You already met your deductible. You thought you were protected. But here is the secret they do not want you to know. That bill may be illegal. A federal law passed in 2022 called the No Surprises Act has a specific loophole that actually protects you in this exact situation. And if you know how to use it, you can make that $5,000 bill disappear. By the end of this video, you will understand exactly how the No Surprises Act protects you from out-of-network balance billing. You will learn the 3 specific situations where you are fully protected, the one gap in the law that still leaves you exposed, and the exact words to say to your insurance company to force them to reprocess your claim. I will give you a step-by-step script to dispute any surprise bill, whether you are in the emergency room, a scheduled surgery, or even an air ambulance. This is not theoretical, this is the law, and it is on your side. Let me start with the most important date in recent health insurance history. January 1, 2022. That is when the No Surprises Act went into effect. Before that law, surprise balance billing was a nightmare. You could go to an in-network hospital, and every single doctor who touched you could be out of network. The anesthesiologist, the radiologist, the pathologist, the assistant surgeon. They would all send separate bills. Your insurance would pay their in-network rate, and the doctor would bill you for the difference, often thousands of dollars. The No Surprises Act changed that. It says that if you receive emergency services at any hospital, in-network or out-of-network, you cannot be balance billed. You only pay your in-network cost sharing. It also says that if you receive non-emergency services at an in-network facility, you cannot be balance billed for out-of-network providers like anesthesiologists or radiologists, unless you explicitly consent in writing. That is the loophole that protects you. Now here is the pattern interrupt that most people do not know. The law applies to air ambulances too. If you are in a serious accident and need to be flown to a trauma center, the air ambulance company cannot balance bill you. You pay your in-network cost sharing. However, there is a massive gap in the law. Ground ambulances are not covered. That means if you take a ground ambulance to the hospital and that ambulance company is out of network, you can still receive a surprise bill for thousands of dollars. This is the one gap that Congress has not closed. Some states have passed their own laws, but most have not. If you live in a state without ground ambulance protection, you are still vulnerable. So how do you actually use this law to fight a surprise bill? Let me give you the 3-step playbook. Step 1, determine if your situation is covered. Are you protected? You are protected if you received emergency services at any hospital, regardless of the facility's network status. You are protected if you received non-emergency services at an in-network facility and an out-of-network provider treated you without your knowledge. You are protected if you were transported by an air ambulance. You are not protected if you knowingly chose an out-of-network provider for a scheduled procedure and signed a waiver. You are not protected for ground ambulance services in most states. If your situation is covered, move to Step 2. Step 2, do not pay the bill. Do not make a partial payment. Do not sign anything. If you pay even $1, you may be deemed to have accepted the charge. Put the bill in a folder and do not touch it. Step 3, call your insurance company. Say these exact words. I received a bill from an out-of-network provider for services covered under the No Surprises Act. This is a surprise bill. Please reprocess the claim at the in-network rate and notify the provider of their obligation under federal law. If the insurance company gives you trouble, escalate to a supervisor. If they still refuse, file a complaint with your state insurance commissioner. You can also file a complaint with the Federal Department of Health and Human Services. The federal government has a No Surprises help desk at 1-800-985-3059. Use it. Let me give you a real-world example. A woman in Ohio went to an in-network hospital for gallbladder surgery. The surgeon was in-network. The hospital was in-network. The anesthesiologist was out-of-network. 2 months later, she received a bill for $2,800 from the anesthesiologist. Her insurance had paid $800. The anesthesiologist wanted the remaining $2,000 from her. She had heard about the No Surprises Act. She called her insurance company. The agent told her the bill was her responsibility. She asked for a supervisor. The supervisor said the same thing. She then filed a complaint with the Ohio Department of Insurance. Within 3 weeks, the insurance company reprocessed the claim. The anesthesiologist was paid the in-network rate. Her balance was reduced to zero. She saved $2,800 with 3 phone calls and 1 online form. Now let me talk about the consent waiver. This is the hidden trap that can strip away your protections. The No Surprises Act allows out-of-network providers to ask you to sign a written consent form that waives your surprise billing protections. This can only happen for non-emergency services. The provider must give you a clear notice explaining that you are giving up your rights, and they must give you at least 72 hours to think about it. You are never required to sign this form. If a provider asks you to sign a waiver, say no. Ask for an in-network provider instead. If they refuse, find another provider. Never give away your legal protections. What about the UK and Canada? The rules are completely different. In the UK, the NHS is free at the point of use. There are no surprise bills. However, if you have private health insurance, you could face shortfall bills if your consultant charges more than your policy's limit. Always check your policy's fee schedules before you agree to treatment. In Canada, provincial health plans cover medically necessary hospital and physician services. You will not receive a surprise bill from a doctor or hospital within your province. However, if you travel to another province, you may face gaps. Quebec, for example, has not signed reciprocal billing agreements for physician services. That means Quebec residents must pay up front when seeing a doctor in another province and are only reimbursed at Quebec's lowest rates. If you are Canadian, the No Surprises Act does not apply to you, but your provincial health card is your protection. If you receive a surprise bill in Canada, contact your provincial health ministry immediately. Let me also address the difference between surprise billing and balance billing for out-of-network care that you chose. If you knowingly go to an out-of-network doctor because you want their expertise, the No Surprises Act does not protect you. You are responsible for the difference between what your insurance pays and what the doctor charges. The law only protects you when you had no choice, such as in an emergency, or when you were treated by an out-of-network provider at an in-network facility without your knowledge. So if you are scheduling a surgery and you want to use an out-of-network surgeon, get a written estimate of your out-of-pocket costs before you agree. Negotiate. Ask for a discount for paying cash. But do not expect the No Surprises Act to save you. Here is a quick reference for when you are protected. Emergency room visits protected. In-network hospital stays with out-of-network surprise providers protected. Air ambulance protected. Ground ambulance, not protected in most states. Out-of-network care you chose voluntarily, not protected. Services at an out-of-network facility that you chose voluntarily, not protected. Let me give you a step-by-step script for handling a surprise bill. Step 1, do not pay. Step 2, call your insurance company. Say I received a balance bill from an out-of-network provider for services at an in-network facility. This is a surprise billing violation. Please reprocess the claim at the in-network rate. Step 3, if the insurer refuses, ask for a supervisor. Step 4, if the supervisor refuses, file a complaint with your state insurance commissioner. Step 5, if the state insurance commissioner does not resolve it, file a complaint with the Federal No Surprises Help Desk. Step 6, if all else fails, contact a consumer attorney. Many will take these cases on contingency because the law provides for attorney fees. Let me recap the key takeaways. Number 1, the No Surprises Act protects you from balance billing for emergency services, for out-of-network providers at in-network facilities, and for air ambulances. Number 2, ground ambulances are the biggest gap in the law. You can still be balance billed for ground ambulance transport in most states. Number 3, never sign a consent waiver giving up your surprise billing protections. You have the right to say no. Number 4, if you receive a surprise bill, do not pay it. Call your insurance company first. Number 5, use the exact script I provided. Reprocess this claim at the in-network rate. Number 6, if your insurer refuses, escalate to your state insurance commissioner. Number 7, in the UK, surprise billing is not an issue on the NHS, but private insurance may have shortfall bills. Check your policy. Number 8, in Canada, provincial health plans protect you within your province, but interprovincial travel has gaps. Always carry travel insurance. Here is what I want you to do right now. If you have a surprise medical bill sitting on your desk, do not ignore it. Do not pay it. Go to your insurance company's website and find the No Surprises Act complaint form. Fill it out. It takes 10 minutes. That 10 minutes could save you thousands of dollars. And if you have not received a surprise bill yet, save this video to a playlist. You never know when you might need it. If this video helped you understand your rights under the No Surprises Act, hit the like button. It helps more people learn how to fight back against illegal bills. Subscribe and turn on notifications so you do not miss my next video, which is called the one page of your health insurance policy that will save you thousands. And comment below, have you ever received a surprise medical bill? How much was it, and did you fight it? Share your story and your state. I read every single comment. Thanks for watching. Now go protect yourself. See you in the next one.